Are you ready, nurses? Okay, so example of question related to handling or administration of your high-risk medications. Alright, number 1. Okay, so focus tayo sa handling or administration of your high-risk medication. So this is possible question in your actual NCLEX. Which of the following drugs should the nurse question? Okay, which one should you question? Okay, so this is related to your pharmacological and parenteral therapies, especially handling and administration of your high-risk medications. Alright, letter A, Lanoxin for an adult patient, heart rate of 65, RR of 13, and blood level of your digitalis, which is 0.6 nanogram per ml. Okay, so blood level of digitalis, 0.6 ng or nanogram per ml. Okay, and letter B, nurses, you have Arvidilol for client with bronchial asthma, heart rate of 70, RR of 15, blood pressure of 120/80. Alright, letter C, Captopril for client being discharged post-myocardial infarction. And for the last option, Hydrodiuril for a client with stage 1 hypertension. Which one should you question? Okay, so you can comment your answer on the comment section. Okay, so which one? Okay, do we have a winner? Okay, I think we have a winner. Okay, so congratulations for those who got the correct answer. But before I give you the correct answer, okay, of course, in MindWeb, we will not just be giving you the correct answer. We will explain each of the options. Okay, so each of the option, i-discuss natin, and then we'll identify which one, okay, should you question. Okay, so nurses, we are talking about high-risk medication. Am I correct with that? Okay, so when you say high-risk medication, they are potentially harmful for the patient. Okay, and when you say high-risk medication, they have higher chance of causing harm to the patient. And this will include also medication with a narrow therapeutic index or with a narrow margin of safety. When I say narrow therapeutic index or narrow margin of safety, the therapeutic dose is very close to its toxic dose. Pag tatagalugin natin, yun yung mga gamot na konting taas na sa blood ng client natin, magiging toxic na po siya because they have narrow margin of safety. The therapeutic dose is very close to the toxic dose. Kaya konting taas na ng gamot natin, okay, will be harmful to your patient. And that will include, of course, your digoxin. Digoxin or a cardiac glycoside has narrow margin of safety. That will include also, nurses, your psych drug, which is your lithium. Lithium also has narrow margin of safety. Okay, that's why this common question in your NCLEX. And then don't forget also your xanthine derivatives bronchodilators, your aminophylline, your theophylline, they have also narrow margin of safety. That's why you have to know, okay, the therapeutic levels of those medication. Those are high-risk medication. Okay, so for question number 1, okay, so how do we explain letter A? Let's focus first on, okay, option A. Okay, let's discuss option A here. For the option A, we have Lanoxin. Okay, always remember, nurses, your Lanoxin is a digitalis, a cardiac glycoside being used for patient with congestive heart failure. Okay, so indication of your Lanoxin is congestive heart failure. Okay, you might be asking why, okay, that digoxin or Lanoxin or a cardiac glycoside is being used for patient with congestive heart failure. In patient, nurses, with congestive heart failure, our basic problem here is the decreased force of cardiac contractility. Okay, the decreased force of your cardiac contractility. contractility. Okay, pag sa Tagalogin natin nurses, yung myocardium, okay, nagko-contract siya ng mahina. Pag mahina siya mag-pump, okay, so the cardiac output will be decreased. What will happen to the remaining blood, okay, in the heart chamber is that they will try to congest or accumulate. That's why the term congestive heart failure. This is due to what? The decreased, okay, force of cardiac contractility. Mahina kasi mag-pump yung cardiac muscle natin. Did you get my point? Okay, titingnan natin ang representation. Pag ganito ka, okay, forceful, ganito ka, okay, taas, ang force ng cardiac contraction natin, madami po bang blood na ipapump sa systemic circulation? Yes. Okay, so there's no chance na mag-accumulate or mag-congest ang blood natin. Am I correct with that? Yes. What about nurses? Pag mahina na mag-pump yung heart muscle natin, there is no decrease in your cardiac contractility. Madami po ba yung cardiac output or kokonti? Kokonti yung cardiac output natin, right? Okay, since so konting lumalabas na cardiac output, the blood will just accumulate, leading to your congestive heart failure. Okay, and so the next question, how can digitalis or lanoxin answer the decrease in the force of your cardiac contractility? This is now the discussion or the explanation. Alright, your lanoxin nurses will answer, okay, the problem in stage F, which is decreased force of cardiac contractility, because, okay, lanoxin has two effects. Okay, your lanoxin has two effects. Okay, one effect of your lanoxin is that it has positive, okay, inotropic effect. Okay, it has positive inotropic effect. The second effect of your lanoxin or your dioxin or a cardiac glycoside is that it has negative chronotropic effect. Okay, it has negative chronotropic effect. Okay, when you say nurses inotropic, I'm talking about the force of cardiac contractility. So this would refer to the force of your cardiac contractility. Since the effect of lanoxin is positive inotropic, it will therefore increase the force of what? Cardiac contractility. Okay? Ibig sabihin sa Tagalog, since positive inotropic ang effect ni lanoxin, okay, tataasan niya ang force, okay, ng cardiac contractility natin. Ano ba yung problema sa CHF natin? Decreased force of cardiac contractility. Therefore, lanoxin will answer that problem. It will increase the cardiac contractility because it has positive inotropic effect. The second effect is the chrono. Chronotropic nurses refers to the heart rate. But if you can notice, what's the effect of lanoxin to the chronotropic? Okay, or the heart rate? Okay, negative. So therefore, it can decrease the heart rate of your patient. Okay, so it can increase the force of your contractility, thereby increasing the cardiac output. Pero mabagal mag-beat ang heart natin. So it can decrease the heart rate of your patient. Okay, from these two effects, nurses, you can now, of course, okay, make a conclusion. Ano yung magiging nursing implication nun? May positive inotropic siya and may negative chronotropic po siya. Okay, so this will be the nursing implication. Okay, as nurses, we need the hallmark nursing responsibility for patient taking lanoxin is to check the heart rate for 1 full minute. Okay, for 1 full minute, check the heart rate because it has what? Negative chronotropic effect. It can lead to bradycardia. So check the heart rate for 1 full minute. Hold your lanoxin, nurses. Okay, hold your lanoxin if you have heart rate of less than 60. Okay, so hold your lanoxin if you have a heart rate of less than 60. So you can always question if your question in NCLEX is lanoxin and the heart rate is less than 60. Question that order. Okay, question that order. So if the patient is suffering from bradycardia and the doctor's order, okay, is lanoxin, question that order. Let's go back to question letter A. Let's check if there is bradycardia in letter A. Okay, so what are the vital sign trends, okay, in letter A? So that we can identify first. If you can notice, nurses, in letter A, the prescribed medication is lanoxin. Am I right? Yes. The heart rate is 65. Should I question that? Obviously no, right? Because I can only question if the client heart rate is less than 60, but we are still within normal. So this is a correct order because the heart rate of your patient is within normal range. Am I correct with that? The RR also is within normal. The blood level of digitalis also is within normal because the normal therapeutic level of your digoxin, okay, no more of this in our program, but I will be of course mentioning the therapeutic level. The therapeutic level of your digitalis is between 0.5 to 2.0 nanogram per ml. Okay, that's the normal therapeutic range. Okay, so you have 0.5 to 2.0 ng or nanogram per ml. Okay, above 2.0, that is now considered toxic to your patient. Okay, so if you can notice, I don't need to, okay, question this order. Why? The heart rate is still within normal. When is the best time to question the doctor's order? If lanoxin is ordered and the heart rate of the client is below normal. So I don't need to question letter A. Okay, so I have to eliminate letter A. That is a correct order. Okay, so let me proceed to letter B. Can you still follow? I hope everything is clear. Okay, can I see a thumbs up sign? Can I see a heart sign if you, okay, get, okay, the discussion? Alright. Okay, so for letter A, we should not question the order because the heart rate is still within normal. Okay, question lanoxin, okay, if the heart rate is less than 60. Alright, let's check letter B. Okay, I still need your full attention. Alright, possible, okay, this is how to analyze your question in NCLEX. Analyze each option. So I have to eliminate now letter A because, okay, that's a correct order. Okay, what about letter B? Okay, carvedilol. Your carvedilol nurses, okay, is considered to be a non-selective. Okay, so to be more specific, your carvedilol is a non-selective beta blocker. Alright, so take note of the term, it's non-selective, okay, beta blocker. Okay, I know medyo mahirap ng konti. You may find that, okay, quite, okay, difficult. Why? Because, sir, what's the meaning of non-selective beta blocker? Okay, when I say nurses non-selective beta blocker, you can only understand that if, again, okay, you know your anatomy and your physiology. Okay, for the purpose of discussion, in your anatomy and physiology nurses, we have what you call two types of beta receptor site. Okay, the first one here is a beta 1 receptor site. Okay, beta 1 receptor site. Beta 1 receptor site nurses is abundantly located in the heart muscle. Okay, so abundantly located in the heart muscle. Once stimulated, okay, this can increase the heart rate of the client. So beta 1 stimulation increases the heart rate. Always remember that. Alright, your beta 2 receptor site is located in the smooth muscle of the bronchial airway. Pag tatagalugin natin, doon naman siya located most abundantly sa daanan ng hangin. Did you get my point? Stimulation of the beta 2 in the bronchial airway can lead to your bronchodilation. Alright, it can lead to bronchodilation. So this is what we're going to happen. When you say nurses, beta blocker, okay, specifically non-selective beta blocker, it will block both beta 1 and beta 2 receptor site. Okay, so let me discuss. Since we are talking about beta blocker, and it's non-selective, so it can block both beta 1 and 2. Blocking of beta 1 nurses, if I block this one, let's do the mind mapping. If I block beta 1 receptor site, okay, can it decrease the heart rate? Yes. If I decrease the heart rate, okay, kasi po, pag na-stimulate, mag-i-increase ang heart rate. Tama po ba? Pag i-block natin siya, mag-decrease yung heart rate natin. It's just the opposite. Am I correct? If I decrease the heart rate nurses, okay, mabagal na yung pagtibok ng puso. Ano yung cardiac output natin? Kasi mabagal, okay, yung heart rate natin. Dadami po ba yung cardiac output or kokonti yung cardiac output natin? Obviously, that can lead to a decrease in cardiac output. Am I right? Okay. Decrease in cardiac output nurses can decrease your blood pressure. Therefore, a beta blocker is an anti-hypertensive agent. One of your anti-hypertensive agent. But take note, hindi siya direct doon sa BP. Yung effect niya is babagalan niya muna yung heart rate natin. Pag mabagal na yung heart rate, kumukonti yung cardiac output na lumalabas sa heart. Okay? Pag kumonti na yung cardiac output natin, tsaka pababagsak or bababa yung BP ng client natin. So, hindi siya direct doon sa blood pressure. Babagalan muna niya ang heart rate. Okay? So, sorry. Okay, medyo paulit-ulit ako para makuha natin yung topic natin. Did you get my point? Alright. Okay, since we are talking about non-selective beta blocker, which is your carvedilol, wala siyang pipiliin. Since it blocks beta 1, yes, so therapeutic because it can decrease the blood pressure. But nurses, since it's non-selective beta blocker, it can block also the beta 2 receptor site. Am I correct? If you block the beta 2 receptor site, okay, this bronchodilation, okay, will give us bronchoconstriction. Okay, so therefore, what's the therapeutic effect of your carvedilol? It's an anti-hypertensive agent. That's good for patients with hypertension. But since it's non-selective, it can cause bronchoconstriction. So ask yourselves, okay, nurses, since it can cause bronchoconstriction, can it be given for client with chronic obstructive pulmonary disorder, just like bronchial asthma? Obviously, no. Why? In bronchial asthma, okay, narrowed na ang airway ng client natin. Tama po ba? Pag bibigyan pa natin siya ng carvedilol, which is non-selective beta blocker, the beta 2 receptor site in the airway can be blocked also, leading to bronchoconstriction. So, the more naliliit yung daanan ng hangin, am I correct? And that can lead to your respiratory arrest or respiratory problem. So, nurses, should I question this order? Carvedilol for client with bronchial asthma. If you can notice, very confusing pagdating ng NCLEX, all of your vital signs are within normal range. Tama po ba? Pag nakita ko na normal range lahat, sabi ko, hindi ko na to i-question kasi normal siya lahat. Am I correct? But what is confusing here? Carvedilol is non-selective beta blocker. For patients with COPD, we need a selective or a cardioselective beta blocker. When I say selective or cardioselective, it will just block the beta 1 without blocking the beta 2 receptor site. Without blocking beta 2, I can still maintain the bronchodilation. That drug is a cardioselective, and that will include your metoprolol, and that will include also your atenolol, but not your carvedilol. So nurses, should I question letter B? Yes, I have to question this order. Okay? So the best answer here is letter B. You have your bravo. Okay. Captopril nurses is being used for client with MI. So that's an approved recommendation. Why? Okay. Because captopril is an antihypertensive agent. It can eventually lead to a vasodilation. Vasodilation nurses can decrease the workload of the heart. So that's our purpose post-MI. You have to decrease the workload of the heart. Pag tatagalugin ko, dilated kasi ang blood vessel. Pag nagbigay tayo ng captopril. Pag dilated, hindi nahirap ang heart na mag-pump ng blood sa dilated na blood vessel. So ang workload po niya dinidecrease natin. Hindi hirap yung heart na mag-pump ng blood kasi dilated po. Okay? So, tinatagalog natin para mas maintindihan. Again, your captopril can eventually lead to vasodilation and thereby decreasing the cardiac workload, which is our goal for client post-myocardial infarction. Okay? Then for letter D, hydrodiuryl is a thiazide diuretic agent and can be used for patient with stage 1 hypertension. Okay, but before I end the discussion in number 1, question captopril if there is hyperkalemia. Okay? Question hydrodiuryl if the client has what? Hypokalemia. Why? Hydrodiuryl is a potassium wasting diuretic. Umiihi ka dito ng madaming potassium. So, if the client is suffering from hypokalemia, question that order. Okay? In captopril, you need to question the order if the client is suffering from hyperkalemia. No more of this discussion in our actual digital program. That is how we explain in MindWeb. Okay? Question lanoxin if the heart rate is below normal. But at this point, the best answer is letter B because carvedilol is non-selective beta blocker. I hope everything is clear and congratulations for those who got the correct answer.